So it's a few minutes past 6, and welcome to another NKF webinar. So this evening we're pleased to host Living Well with IgA. Now, this webinar is sponsored by CSL. We're going to be covering understanding IgA, psychological insights and practical tools, patient and caregiving perspective, and then we're going to have a Living Well panel where there's your chance to have your questions and answers section. And if you do want to ask a question, please write it in the chat box, but please be aware that we're not able to answer all the questions and we cannot discuss individual medication. But pop your questions in and we'll try and do our best. So let's get started. And it's my pleasure to introduce our first presenter, Dr. Lisa Willcocks.
Thanks very much, Pete. And thanks for the opportunity to talk about IgA nephropathy. Moving on to my slides, I'm going to talk a little bit about IgA nephropathy. So you may know that it's a rare progressive kidney disease that is limited to the kidneys, and it generally affects adults. It affects about 1 in 50,000 people, so that's about 1,400 in the UK, and it usually affects younger people in their 30s and 40s, or at least that's when people often initially present with IgA nephropathy. It's more common in men than women, at least in the UK and Europe, where it affects about twice as many men as it does women. But interestingly, in the Far East, where IgA nephropathy is more common, it affects men and women much more equally. So on to the next slide, please. So often people with IgA nephropathy, at least initially, don't have many symptoms. People are often found to have the disease incidentally. So people might go to have a medical as part of work. Somebody dips the urine and finds they have blood and protein in the urine, and that starts the ball rolling in terms of a diagnosis of IgA nephropathy, or IgAN, as it's often referred to. Often it's picked up during pregnancy, so that's often the first time that ladies have blood and have their urine checked, and they're found to have blood and protein in the urine, which then persists after pregnancy, and then they have more tests done. There's no urine screening program in the UK at the moment, and this is something that us as kidney doctors are trying very hard to change, because it would be so helpful to pick people up earlier on a urine test, which is a very simple and cheap test. In the Far East, where IgAN is a bit more common, there are screening programs, and it does mean that people are picked up in an earlier stage of the disease. Sometimes people do have symptoms, and that's what takes them to the doctor. So sometimes people notice frothy urine. So when you've got a lot of protein in the urine, it makes it frothy. So you notice in the toilet your urine's got frothier. People go along to the doctor, who tests it and finds they have blood and protein there. Sometimes people have visible blood in the urine, and this often happens when people have an upper respiratory tract infection. So if you have a virus in your throat, or a cough or a cold, that can stir up the IgA nephropathy, and it can cause inflammation in the kidneys. And then when you wee, sometimes you can see red blood, or Coca-Cola coloured urine, and that takes people along to the doctor, and they have more tests. A lot of people come to us because they've been found to have high blood pressure. Particularly when young people are found to have high blood pressure, we worry there's something driving that blood pressure, and they have tests done to test their kidneys, and they're found to have, again, blood and protein in the urine, or abnormal kidney function, and then they're sent along to a kidney doctor to investigate it. And sometimes people have a blood test for a completely unrelated reason, and that it's found that their kidney function isn't normal, or isn't as good as it should be for their age, and that's what takes them to the doctor. But often by the time, because this is just a serendipitous finding, often people have had the disease for a long time before they come to see us as kidney doctors, and so they've already often had quite a lot of kidney damage. They've lost quite a lot of kidney function before they get to us. We do all have a lot of spare kidney capacity, so you can often lose more than half of your kidney function and feel completely fine. But when your kidney function gets lower than that, so once you get to stage 4 or 5 kidney disease, which is where you've lost probably 2/3 of your kidney function, you can have symptoms of tiredness, That's often one of the earliest things. As kidney failure gets worse, often people sort of lose their appetite and sometimes feel nauseous as well. So those are very late symptoms of chronic kidney disease. And in fact, 2/3 of people with IgA nephropathy already have chronic kidney disease, stage 3 or above at the time of diagnosis. So 2/3 of people have already lost quite a lot of kidney function before they get to us. So it's very important as kidney doctors that we make sure we protect their kidney function and do everything we can to stop it getting any worse. In terms of how you make a diagnosis of IgA nephropathy, you have to do a kidney biopsy. So you can't make the diagnosis without doing a kidney biopsy. So those of you with IgA nephropathy will know all about kidney biopsies. Okay, so moving on to the next slide now, and I'm just going to hand over to Jude, Jude Allen, who's a pharmacist, who's going to tell you a little bit more about medications. Over to you, Jude.
Thanks, Lisa. So my name's Jude Allen. I'm a senior renal pharmacist based at Salford Royal, and I work quite heavily with patients that have IgA nephropathy. So over recent years, it's been really interesting. There's been a lot of interest from pharma companies, especially to do with IgA, and we're getting lots and lots of new and exciting medicines coming to market. Obviously, that's really great news because a few years ago, there was very little out there to actually manage IgA specifically, and we were just looking at managing the actual symptoms of your chronic kidney disease rather than the disease itself. So although it's really great news that we've got all these medications that are being developed and coming to market, obviously for you as patients, it does then increase up your tablet burden. Prior to being diagnosed with your IgA, you might have only taken the occasional paracetamol. And now with all these new medications and new treatments, we're asking you to take 4, 5, 6 new medications a day, which can obviously be quite overwhelming for you. Now, some of those medicines might be very specific for the IgAN, helping to sort of regulate the actual disease process itself, maybe reducing the complex formation. Others of the medications are, like I mentioned before, more to just manage the actual symptoms of chronic kidney disease, reduce the protein leak in your kidneys. So with all these new medicines, it might be quite daunting for you, and you might not understand why we're putting you on all the medicines. So do make sure you talk to your healthcare team. We're always happy to explain the rationale why we're prescribing certain medicines for you and what benefits we think you're going to derive from them. As Lisa just mentioned, you might have had your diagnosis while you feel absolutely fine and you don't have any symptoms. So why are we then asking you to take these medicines that don't necessarily make you feel any better? In fact, with some of them, you might even feel worse because you might experience side effects without realizing the benefits that they're giving you. So it's worth just bearing in mind, obviously, your healthcare team is only going to prescribe things for you that we believe is going to help your disease, slow the progression of your kidney disease, and ultimately give you a better prognosis. But again, if you're not sure about that, just speak to your team, have that two-way conversation so that you can understand why we've prescribed the things that we have. Obviously, with all new medications, well, with all medications, there's the possibility of side effects. If you do have any side effects, do speak to your team about them. Don't sort of suffer in silence, especially with new medications that are coming to market. It's really important that we feed back to the Medicines Health Regulatory Authority of any suspected side effects, because all new medicines are under surveillance for a few years, and we need to know about anything that you think might be related to that medicine so that we can feed back to them and they can feed back to the pharmaceutical companies about any common themes that might be occurring with patients. Obviously, with all these new medications, you might then struggle to remember to take them all. You might miss medications. So there are a few hints and tips and devices out there that can help you to remember and improve your adherence. So there's apps that you can download on your phone. Some people just find a simple alarm going off can help them. You can buy from the majority of community pharmacies and from places like Amazon, little self-filled dosette boxes, like a little plastic strip with the days of the week on. So you can fill that up at the start of each week. And then at least at the end of the day, you can remember whether or not you've taken your medicines that day. My husband has one of those and finds it particularly useful because he often forgets to take his medicines. Other little tricks like leaving your medicines beside your toothbrush. chances are you're brushing your teeth twice a day. So if you've got medicines to take twice a day, take them at the same time. Obviously, we're all just human and people do forget to take medicines. The majority of the patient information leaflet that comes with your medicines does explain to you what to do if you do miss a dose. And in the majority of cases, it's do not double up the next day, just write it off and start back at 0 kind of thing. As we discussed, you'll be in clinics quite regularly throughout your disease process, and we'll be having regular bloods and urine monitoring. So some of the blood tests we do help to check that you're not suffering with side effects from some of the medicines. Others of the blood tests will be checking to see your response to treatment. If treatment isn't helping you, then we wouldn't continue it on, unless it's deriving some benefit for you. So hopefully you'll be able to fit the new medicine regimes into your day-to-day life without too much disruption. But if you are struggling, then please do speak to your healthcare team. We can help come up with strategies to manage side effects that you might have. We might be able to simplify medicine regimes. And equally, it's really important for us to hear from you about any problems you're having with the medicines, especially with some of these newer treatments that we don't have much experience of. So if you can feed back to us, we can help use that information to develop treatment strategies and therapies for patients going forwards. So my main message from this is please do speak to us about your medicines. If you've got questions, if you've got worries, we can help alleviate those hopefully, and together we can get you on a medication treatment and regime that suits you as well. I'm going to hand over to Jessica now, who's a doctor in psychology.
Hi everybody, it's really nice to be here this evening as part of this webinar. My name's Jessica Dean and I'm a clinical psychologist and I work as part of the renal team based at Salford Royal Hospital. I'm just going to start with a very quick overview on the next slide of what I'm going to talk about this evening. We're going to have a brief overview of the particular psychological challenges that come about as a result of living with IgA nephropathy. We're going to look at some of the common emotional responses that people describe having and the impact that they have. I'm going to spend a little bit of time just talking about how our brains work, particularly when we're confronted with stress or difficulty. I'm going to touch on a few psychological techniques that are helpful in helping us to cope when we're under pressure. And I'm going to be directing people to some sources of further information and support if people are interested. So I think as the previous presenters have touched upon, there's a number of aspects to living with IgA nephropathy that can make it psychologically a little bit challenging. So the fact that it's often diagnosed when people are younger and that it's a relatively rare cause of kidney failure, and the fact that people often receive a diagnosis quite out of the blue and unexpectedly, contribute to the fact that emotionally and psychologically it can come as quite a shock. The fact that the disease is sometimes only diagnosed after there's been progression and kidney function is already impacted by that point. And the fact that the treatments can have a treatment burden, so the impact of taking medications, any side effects that people might experience, and sometimes the intrusive nature of some of the treatments, such as dialysis or transplantation, can make it particularly psychologically and emotionally difficult. The fact that the disease progression for some people can be a little bit unpredictable makes it quite hard to live with. And it's a lifelong condition that does require careful management and lifestyle changes, which obviously then has implications for all other aspects of people's life. So people's working life, their relationships, their finances. And all of these things combined mean that it can be quite a challenging diagnosis and condition to live with. So just moving on, people who are living with IgA do often talk to me about experiencing quite a range of emotions as a result of their condition. So people often talk about experiencing feelings of anxiety or worry, and this can be particularly the case around waiting for blood results or looking at their kidney numbers when they have had their bloods taken. People often talk about experiencing feelings of shock or fear. Sometimes feelings of sadness or depression can show up. And something that many people talk about when they experience living with IgA is a sense of loneliness, a sense of isolation, or feeling that perhaps people around them don't necessarily understand quite what it is that they're going through. The uncertainty aspect of living with any kind of long-term health condition can be emotionally difficult. And sometimes it's quite understandable that maybe feelings of anger or frustration might show up. I think it's also really important, though, that we acknowledge that many people identify that their experience of their health condition leads to some positive emotions as well as difficult ones. And people often talk about feeling that they develop a sense of strength or courage or resilience as a result of what they've been through. And people often talk about a sense of gratitude and an acknowledgement of the positive things in their life. So what impact do these emotions have for people on everyday life? If we just move on to my next slide, people report that sometimes these emotions that show up as a result of living with IgA can have sometimes a good and sometimes a not so good impact on their everyday life. People say that sometimes these feelings can affect their enjoyment of things that they used to enjoy. People often talk about an impact on sleep. It can lead to disturbed sleep. And that often results in reduced activity levels or an experience of fatigue or loss of energy. Other things that people have reported is feeling a bit isolated from friends and family. Sometimes a loss of confidence or just a sense that their self-esteem doesn't feel quite as good as it used to. And we've already touched upon the fact that many patients experience a sense of worry or a sense of anticipation in advance of going to the hospital, having medical consultations and waiting for blood test results. People have also touched upon the fact that coping with other people's reaction to their diagnosis can also be difficult. So it's not just their own feelings that they're dealing with, but it's the reactions and feelings and worries of those people around them as well. But again, like many things, there's also quite a few positive impacts that having a long-term health condition can lead to. And many patients that I've spoken to have talked a lot about how much it has led to an improved focus on their health and their well-being, and that it's led to them recognizing what really matters in life and what they want to focus their time and energy and attention on. So people have also told me that there are some specific parts of an IgA journey that they feel can be psychologically more challenging. An initial diagnosis is something that people often describe as being quite shocking for them. It can lead to a sense sometimes of feeling a bit numb or a sense of disbelief. And that the most often used description that people report to me is that at the beginning, it doesn't even feel very real. People have often said as well that when they commence initially on treatment, medication, or for some people starting onto dialysis, that sometimes that feels like a bit of a loss of control, and that it can be initially quite difficult to cope with the treatment burden and the side effects that they might experience. And people talk about finding the bodily changes that they experience as a result of medication or dialysis quite difficult to cope with. And the general sense in relation to starting and going through treatment is that it really disrupts normal everyday life routine. Some people have reported that a few months into treatment is when things start to feel quite real for them, and that worry or anxious anticipation or low mood might start to show up at that point. And many people have reported that first year anniversary, so the first year of having received a diagnosis and been living with their condition, that sometimes people say that that's the point for them at which their emotions actually catch up, and that they move from a very practical coping, trying to get on with things mode, to actually starting to recognize and process some of the emotions that might show up. And then people have often talked about specific trigger points as well. So perhaps when people are starting a new relationship or starting a new job, and they're having those conversations with new people in their lives about their condition and the impact of their condition. Or for some people, it might be they're thinking about starting a family, or there's a relapse of IgA disease or a commencement onto dialysis, undergoing or losing a transplant. These are all parts along the journey that can be particular trigger points and can be a little bit more challenging emotionally for people. So what I'm going to move on to talk about now is just a little bit about how our brains work. And the reason I want to talk about that is because sometimes it's helpful to understand how our brains respond when we are under stress or under pressure. And I think it's fair to say that being diagnosed with any long-term health condition, and IgA is the same, that puts an extra pressure on our emotional parts of our brain. So our brain basically has three main systems for processing emotions. It has a drive system, which is an area of the brain whose purpose is really to sort of motivate us in terms of our behaviour. It seeks to keep us active, it seeks to keep us moving towards our goals, and it keeps our motivation levels high. The soothing part of our brain is called the soothing system, and that is primarily responsible for feelings of contentedness and keeping us calm and keeping us feeling relaxed. And then the third system in the brain, that the parts of the brain that process emotions, is the threat system. And the whole role of the threat system is to seek to keep us safe. So its primary responsibility is to look for threat in the environment and look for ways to keep us safe. Now, ideally, what we would have at any one time is all three of those systems in equal presence. So no one part of the brain system outweighs the other. But what often happens when we experience something that's difficult or challenging or somewhat threatening is that the threat system moves up a gear and takes over, and it starts to crowd out the influence of the other two systems. And this is often what happens when we receive a medical diagnosis that's worrying or anxiety provoking. So if we just move on to the next slide, what do we tend to do as human beings when we are faced or confronted with something that's difficult or challenging or threatening? Well, it's important to know that the brain's threat system is triggered not just by physical threat. So on this slide, we've represented physical threat with a tiger. So our brain would respond to physical threat, but it's also designed to respond to mental threat. And mental threat tends to come in the form of thoughts or images or memories. So being chased by a tiger is going to trigger the same response in your brain as thinking about being eaten by a tiger. And when we think about what that means in terms of receiving a significant physical health diagnosis, even just thinking about our health, thinking about our diagnosis, thinking about our treatment, thinking about our blood results is going to trigger that threat system in our brain in exactly the same way as if a tiger was chasing us. Now, it's really important that we know that some fear and anxiety is actually really good for us. It's healthy, it keeps us safe, it allows us to scan our environment, notice what we need to do to keep safe, and act in response to that. So I think in society at the moment, we tend to talk about anxiety as always a bad thing. And I think it's really important to recognise that some level of anxiety is actually safe and helpful and constructive. But what sometimes happens is that when we're repeatedly faced with threat, or we're repeatedly thinking about things that cause us worry and anxiety, our brain threat system gets a little bit too overactive and it starts to become a bit unhelpful. Now, a diagnosis of IgA nephropathy is likely to repeatedly trigger that part of the brain that tells us we're under threat. So often for patients, when they keep coming to the hospital, they keep having conversations about health, they keep anxiously waiting for blood results. What happens to the brain is it constantly gets told you're under threat and it responds accordingly. So we're just going to move on to look at what the alternative or what we tend to do in response to that. So the most natural thing that we do as humans when we're faced with difficult thoughts or difficult feelings or things that feel hard is that we try to push them away. It's a natural instinctive response because the things that we're experiencing feel difficult. And when those things are thoughts or memories or images, what we try to do is push them to the back of our mind and carry on and get rid of them. And as psychologists, we call that thought suppression. Now, initially, suppressing our thoughts and feelings and emotions works reasonably well. It gives us momentary alleviation and we feel a little bit better. But if we just think about the beach ball metaphor that's shown in the diagram here, it takes quite a lot of effort to continually keep pushing things away. So to keep a beach ball underwater, you have to keep applying pressure. And what tends to happen when we do that with our thoughts and feelings is that we start to get tired and we start to run out of energy, and the amount of pressure we need to push them away becomes more and more. And the minute we loosen our grip, they come back with a vengeance. So a bit like a beach ball pops out of the water and smacks us in the face. It's exactly the same when we try to suppress our thoughts and feelings and emotions. Perhaps another way of thinking about it is to imagine a spider's web, where the more you struggle, the more entangled you actually become. And it's only through relaxation and allowing things to be there that we can actually unhook ourselves. So what we try to talk about quite a lot as psychologists, particularly when dealing with physical health and the emotions that show up, is we talk a lot about accepting and trying to make space for difficult emotions and feelings. If we just move to the next slide, this is why we tend to talk about making room for difficulty and making room for difficult thoughts. Because when we accept our emotions, it immediately stops that rebound effect. So we're not wasting lots of precious energy trying to push away thoughts and feelings. And that actually allows space for other emotions as well. Because when we push away one emotion, what we tend to do is it pushes away everything. It pushes away enjoyment. It pushes away excitement. It pushes away pleasure. And it also stops us getting caught up in the wrestle with those thoughts and feelings. What we tend to notice as well is that when we accept that we're experiencing an emotion, it allows us to be more compassionate to ourselves about the fact that we're experiencing it. If we try to pretend that we're not feeling anxious, or we try to push away feelings of fear, we're not then allowing ourselves any kindness or compassion in the fact that we're going through something difficult. What we tend to find when we accept emotions and make space for them is that it uses a lot less energy and effort. And it also allows other people to better understand how we're feeling. And then on top of that, allows other people to express how they're really feeling as well. So if we just move on to the next slide. As psychologists, we talk quite a lot about something called fusion and diffusion. And we do quite like having fancy terms for things as psychologists, but really it's quite a simple concept. Fusion is the process of mistaking our thoughts for facts and truths. So in this scenario, this person is having the thought, I can't cope, and they're immediately assuming that because they're having that thought, it must be true. On the opposite end of the spectrum, diffusion is the process of recognizing that our thoughts are just words or images or memories, and that they don't necessarily have truth or fact contained within them, that they're literally just thoughts. And so the other person might be telling themselves, oh, it's interesting. I'm noticing that I'm having the thought that I can't cope. And if we move on to the next slide, we'll look at the difference between when we become fused with our thoughts and when we can manage to diffuse from them. So as we've just said, fusion with a thought is being really tightly bound up with that thought or set of thoughts. So very, very convinced that because we've had the thought, I can't cope with my health condition, that therefore that's true. Now, unfortunately, that doesn't leave any room for any other alternative thoughts, and it immediately triggers the brain's threat system. It also leads us to believe even more strongly that the thought is actually true. If we start to use techniques to create a little bit more diffusion, immediately what we notice is, even just by introducing those few words, I'm noticing that I'm having the thought that, it creates a space between you and the thought. So you are an observer of the thought rather than bound up tightly in the thought. It allows room for other alternative thoughts to have space. And it might be things like, oh, I notice I'm having the thought that I can't cope, but actually yesterday I coped really well. And the day before that, I coped pretty well as well. So maybe it's just today that I'm feeling like I'm not coping so well. And immediately that subtle difference in how we're thinking about and interacting with our thoughts creates a better experience emotionally. That way of interacting with our thoughts is much less likely to trigger the brain's threat system and actually allows the brain's soothe system to engage to promote feelings of calm and a sense of safety. And it allows us the ability to consider and look at the fact that that thought might not actually be true. So if we just move on to the next slide, what that shows there is that rather than the threat system in our brain repeatedly being triggered by anxious thoughts, what we're actually doing by interacting slightly differently with that thought is we're allowing the brain's soothe system to come in and make us feel calmer and more in control. So I'm just going to move on now just to talk very briefly then about some grounding techniques. Grounding techniques are really good techniques for when we're feeling overwhelmed or when we feel like our internal thoughts are kind of running away with themselves or we're feeling very anxious. And grounding techniques are essentially self-soothing techniques that look to keep you very much connected to what's happening here and now in the moment. So when we become anxious, our thoughts tend to race ahead of ourselves. We're thinking about the future. We're thinking about what might go wrong, what might be ahead of us. Or we're thinking back into the past of difficult things that we've experienced. And our brain gets all mixed up and confused and starts to respond. It creates lots of adrenaline, it creates lots of cortisol, and it makes us feel unpleasant. So grounding techniques are an attempt to try to remind your brain that you're here in this moment and you're safe and everything is okay. So grounding techniques can either be physical techniques or they can be mental techniques. And I'm going to go on the next slide to talk about a couple. So a physical technique is box breathing. And it's a really simple technique where we focus our attention on our breathing and we imagine our breath in the shape of a square. Now, as we breathe in for the count of 4. We hold our breath for the count of 4. We then breathe out for the count of 4, and then hold that gap between breaths for the count of 4. And we repeat that in a cycle, doing nothing more than concentrating on our breathing in that square pattern. And we repeatedly do that until it reminds our brain that actually things are safe, things are okay, the threat system doesn't need to be triggered. Some people might find that a count of 4 is too much for them. And equally, if you did a count of 3 or a count of 2, that works in just the same way. What's really important about that process is the consistency of the in-breath, the holding of the breath, the out-breath, and the pause in between breaths. Another really good grounding technique to use, and particularly one that you can use anywhere and nobody will be able to guess that you're doing it, is what we call the 5-4-3-2-1 technique. So you would focus your attention just for a couple of minutes on 5 things that you can see in your environment, 4 things that you could feel or touch, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. And we often say to people, it's really important to practice these techniques when you're not feeling anxious and overwhelmed, because then you get really good at using them. And when you then are required to use them, say you come to hospital for an appointment or you're waiting for your blood test results, you can use these techniques really easily, even when you're feeling anxious. And some people have said that because they like using the 5-4-3-2-1 technique, that they often carry in their pocket something that they can taste or something that they can smell very readily, because it immediately reminds their brain of that process of calming back down, engaging the soothe system and feeling less anxious. So if we just move on to the next slide, I think what I've tried to present today is an acknowledgement and a recognition that there are aspects of being diagnosed and living with IgA that can present some very real psychological challenges. But sometimes it's helpful to know how our brains work when we are confronted with challenge, because it helps us to understand what to do in response. And so using some of those really simple psychological techniques, using thought diffusion, using grounding, is a really good way of helping to manage those emotions when they do show up. And it particularly works well because what we're seeking to do is engage that soothe system of the brain, and that increases our ability to cope. So I think on the next slide, there's just a little bit of further reading and resources. So if anybody was interested and wanted to read a little bit more about some of the things that I've talked about, there's some websites and a really good book that you might want to have a look at. And then just to say thank you very much for having me here today to be part of this webinar. It's a real honour, and I think it's really important to remember that we're often braver than we believe we are. And I'm just going to pass over now to Lisa and Julie, who are going to talk through the next section.
Thank you very much, Jessica. I think that's so interesting and helpful to have that perspective. And I think I was looking at some of the comments that were coming through. I think as nephrologists, we're not always very good at focusing on the psychological aspects of this. I'm delighted to have Paul and Julie here today as well, who both have IgA nephropathy, and it'd be really great to hear from them. So, Paul, could I start with you? Did you find that your diagnosis of IgA nephropathy affected your mental health and sense of well-being?
Yes, I think it did. It was a shock. Even though I was near to retirement age, it was a big surprise to both me and my family.
And how did it make you feel? I mean, obviously it was a shock, but what were the main things that were running through your mind? What were the things you were worrying about?
I think we've all felt that we are invulnerable and going to live forever. It's quite a surprise to find that there is possibly a life-limiting condition that you have to deal with. So even now, you know, my thinking about friends and family, and friends first of all, if a friend asks after your health, if your answer lasts longer than a minute, their eyes will glaze over. Because the truth is, the only answer they really want is, I'm fine, thank you. Families are different because they care about you and they suffer with you, but they're not in control. So they feel a little bit difficult in a way. I know it's an odd thing, but I have to keep the salt cellar in my peripheral vision. I have to be careful I don't look longingly at a banana, and I have to keep the blood pressure machine at hand to assure my wife that I am doing all of the right things. But the problem is, I just try to get it mostly right most of the time, whereas she is vigilant. So we have to manage that difference between us, which after a number of years we've done. But it presents everyday difficulties, I guess.
And did you find the same, Julie? What were your thoughts when you were diagnosed with IgA nephropathy?
Very similar to Paul. When you first get diagnosed, it's a little bit, you feel a bit numb. The consultant at the time didn't really explain a great deal about the disease. He probably didn't have enough information himself, but I'm a big believer in being positive and looking for information, which I did through Google and found obviously yourself and another gentleman that's very good with the disease as well. So I went to credible sources, which is probably coming from my uni days, is getting the right information and not just getting things off Facebook and things like that. So to me, knowledge is power. If you can understand something about the disease, you can ask questions and you're going through your treatment. But yeah, at the first, it's a bit daunting at the beginning, but I was quite lucky at the time. We were getting a puppy. At the same time I got diagnosed, I had a huge distraction, which, God, that was just brilliant. It was really, really good to have that distraction, to keep your mind off it, keep it in perspective as well. And it got me outdoors even more than what I normally do as well, which for me, nature is a key healer in my head. It was brilliant.
And is there anything, so obviously having a distraction is really helpful. Is there anything else over time that any other strategies or tactics that you've developed to try and help you sort of manage having this chronic condition that's there all the time?
Quite a few what Jessica's already mentioned, I already do. So I'm a big gym fanatic. I go to the gym regular. I've done yoga for many years. Breathing, I know straight away, is it has a big impact on your body as well. And it's a coping mechanism. And if there's anything, especially at night time, anything that's happened, whether recent death in the family, is you at night time, your mind just goes overriding, everything floods in. And that's my coping mechanism at night time. If it does do that, is got to shut them thoughts down as quick as you can before it starts getting worse. And that's breathing. Yoga breathing at night time is my do it. If I need it, breathe it. And I recently started Qigong as well, which is another mechanism of trying to to deal with the things that your body creates naturally, as what Jessica said, all the memories and everything, and the impact it has on your body is quite bad. And as the older you get, you realize how much you have kept in. And he teaches a lot of how to release it as well. It's absolutely fantastic. So we did a refresher actually at Christmas, just after Christmas, about looking at the last year and what's happened and how to deal with it, how to manage it as well. So a lot of tears was in the class from everybody. But afterwards, it was just like, oh my God, it gave me such a huge boost. Unbelievable. And that's what I'm doing this year, is just to look at mechanisms to improve my mental health. What the old, when you things in your head that goes around you, you've got your second, you always taught you, like Jessica's kid, things that are always coming in your head, how to deal with it as well. And I think I'm doing pretty well now, actually.
Thank you. And what about you, Paul? Have you developed a strategy for coping?
Yeah, I think I have, in that the thing that affects me most is the tiredness. I've always been, from being small, my mother and then my wife have told me to slow down and don't be impatient, to take things easy. I'm probably the only person at the airport who didn't need speedy boarding. I was at the front of every queue. And so coping with the tiredness is difficult. What I would say is, you have good days and bad days. Good days are a gift, and make the most of them, especially if you're better in the morning than the afternoons, and enjoy those good days. And on the days that are not so good, then be kind to yourself. It's one of those things that happens. I try not to feel guilty if I have a day where I don't achieve very much. So just to add to what Julie said, really, you have to adjust to new realities in life, and being kind to yourself and making the best of the days that you have, I think, is a good coping strategy.
No, absolutely. I think one of the other things that you often have to deal with when you've got a kidney disease like IgA nephropathy is the slight unpredictability of your numbers. So you come up and see me, or you go for a blood test, and then sometimes your eGFR has dropped a little bit, or you've got a bit more protein in the urine, and that's that obviously can worry people. Obviously, it happens to everybody. I know sometimes it's happened to you, Paul. How do you deal with it when you look at those, when you look your numbers up, and they weren't what you were hoping for?
Well, one answer to that is a very practical one, which is I'm very lucky to be in the care of Addenbrooke's Hospital, and they have a wonderful system called MyChart. So when I've been to see the nephrologist at Addenbrooke's, within hours I can look at not just the results, which could be a bad thing because occasionally they're aberrant, as you've said, but within a second I can go to look at the chart, which shows me the development over time. And as long as I can see the graphs over a number of months, which show me that this is an aberration, then I can cope with it. However, The last time I was there, my filtration rate went down quite considerably, and for all the fancy coping mechanisms, that worried me, and I was very concerned. And the final thing is, in my chart, I can message the clinicians, and which I did, and had reassurance. So I'm just lucky that where I am has such a good feedback system.
Yeah, there often are ways people can see their numbers. There's a system called Patient Knows Best, which is a renal system that's sort of UK wide. So if your hospital doesn't have it, there may be some other way that you can track your numbers. And I think it is helpful for a lot of people to see what the numbers are like. And I to absolutely echo what Paul has said. And if there's something you're worried about, don't ignore it. Ask your clinical team and get it checked out, because it's like Paul says, they might just say, the numbers wobble up and down a bit and it's nothing to worry about. They might say get it rechecked, but I think it is, don't sit on it. Would you agree with that, Julie? I mean, it happens to
Yeah,
everyone, doesn't it? You get a number
yeah.
that you worry about.
Yeah, definitely. And again, same as Paul, I'm under Adam Brooks as well. So the My Chat system, like I say, I'm waiting for my result currently now because I've just seen Lisa earlier. So I know they'll come in around about 6 o'clock. So there's probably an email there already telling me the results are in. So yeah, you get a little bit hesitant to look, but it's nice that they're there very quickly instead of keep waiting and waiting. But the same thing is, I think my GFR dropped a little bit last time, and I was trying to look at some positives in some of the other results, and I think I emailed Lisa and asked her, could you just explain this? Is this good or bad or whatever? And then was reassured, as like say Paul said the same. So just nip it in the bud in the bud before you start. Your brain starts going on overdrive on it as well. So. But again, as we know, the disease, you can't do nothing about it. And that's what I just keep in the back of my mind. It's not something, something that I've done wrong. It's just either genetics. They don't really know why it's caused. So it is what it is. I might feel a bit gloomy sometimes, but other times, like you say, you have good and bad days sometimes. And I throw myself into work sometimes a little bit more to stop the brain going overdrive. But yeah, the My Chat system's brilliant, really, really good.
I think we could probably chat for a lot longer, but we should probably let other people ask some questions as well. So I'll hand over to Justina, who's going to think about some questions and invite some questions from the audience as well. Thanks, Justina.
Hi everyone, I'm Justina Szklarzewicz. I'm lead research nurse from Leicester General Hospital, and actually we have quite a few questions from audience today. This is for our panel, so I will start with the first one. How likely my child is to inherit IgAN?
Shall I take that one? So IgA nephropathy isn't an inherited disease. So just to reassure you, it's very unlikely your child will inherit it. Like quite a lot of other autoimmune conditions, there are risk factors in your DNA that mean you might be slightly more likely to get it. But overall, it's not an inherited disease, so it would be very unlikely for your child to inherit it.
Right, thank you, Lisa. We have also one question about the likelihood of IgAN to reoccur post-transplant.
Okay, so IgA nephropathy does sometimes recur post-transplant. It doesn't always cause trouble though. So sometimes people will do a kidney biopsy on someone who's had a kidney transplant. Sometimes we can see early signs of IgA being deposited in the kidney, but it doesn't always cause trouble. So it's a possibility, and we do discuss it with people. But most people with IgA nephropathy don't get there; it doesn't come back. So you shouldn't not have a transplant because of that. If you've had IgA nephropathy that's already recurred in a transplant, then if you have a second transplant, you would be at higher risk.
Right, thank you, Lisa. So the next question, I think it will be for Pete. So we have a question: how is best for patients to explain IgA to friends and family, and what NKF what support NKF can offer in that?
Yeah, we've got lots of support. We have the helpline, which is free to call during the day. We also have a peer support service as well. And we do have patients that have got IgA. So call the helpline. They can match up with someone. It can be a patient or it can be a carer, a loved one. And they can talk to someone and ask, as many questions as they like. And if they want another referral, they can do that. So yeah, the NKF is here to help.
Brilliant. Thank you, Pete. So very important question for female participants. It's how does the IgA impact fertility, if at all?
So IgA nephropathy doesn't directly affect fertility at all, but having chronic kidney disease in the latter stages can be a problem. So if you've got stage 4 or 5 chronic kidney disease, so your eGFR is under 30, it would be helpful to talk to your kidney specialist about the implications of having a baby. So it might not affect fertility as such, but it might affect your pregnancy and potentially the baby as well. So at that level of kidney function, do have a conversation with your specialist. Often you can go and talk to an obstetrician actually even before you get pregnant. So we call that preconception counselling, just to find out a bit more about what the implications of being pregnant are for you and the baby. So yeah, useful to have those discussions. Some of the tablets that you might be on, you might need to stop either before or when you get pregnant. So it's really useful to plan a pregnancy and talk to your doctor about it, and they'll just tell you, what the risks of having a baby are and the extra care that you might need during pregnancy.
Right, thank you, Pete. Do we have a minute or two to ask another question?
Yeah, let's do one more question, shall we?
Okay, so we have important question about the diet because of the mixed information available online. So what would be the panel's advice on diet in IgAN?
Well, maybe I'll ask Jude in a minute as well. But really, mostly it's about healthy diet. So lots of fruit and vegetables. Paul's already alluded to not adding salt to anything, because salt tends to put your blood pressure up, make you retain a bit of fluid. When the kidney disease is worse, so again, sort of stage 4 and 5 chronic kidney disease, there may be more restrictions on your diet. It's not specific to the IgA nephropathy, but it just comes along with more severe chronic kidney disease, and that might be a low potassium diet. It might be avoiding phosphate, but you should have a dietitian who could support you with that if you're at that stage of chronic kidney disease. Anything you'd want to add, Jude, from a diet perspective?
No, I don't think so. I'd agree with you that there's nothing particularly IgA specific. It's more your CKD, your chronic kidney disease, that you'd be looking for those diet adjustments. Like Lisa said, as your CKD progresses, you might need to adjust phosphate and potassium intake, but it's fine from an IgA perspective. I think sometimes there's some queries, isn't there, about protein intake and things, because you're obviously losing protein in your urine, but to the best of my knowledge, there's nothing that supports restricting your protein for IgA.
Well, thank you very much for all those questions. Sadly, we're just running out of time. And thank you to all our presenters. Kidney disease and IgA, it's dreadful, as we all know, but this webinar has just been so positive and shown patients that they're not alone. There is help out there. There's coping mechanisms as well, and how to deal with all the challenges that you face. The webinar has been recorded, so if you want to watch it again, or you know someone that will benefit from it, it will be available on our website, kidney.org.uk, in the very near future. So hopefully by the end of next week or the week after, it will be on our website, but we will send an email out to everyone letting them know. But thank you to everyone that's attended and took part tonight. Have a good evening.